when the girls are noisy or fighting or, making a big mess, and I start to get frustrated, and then I think I should be happy to be around for all of this. We got to the hospital probably around 3:30 in the morning.
Kathy was normal. There was no concern about, her.
But as they were keeping track of the baby's heart rate, they noticed that it just wasn't really changing, and so that's when they decided to go ahead with an emergency C-section. So I was very worried, and my husband and I both were pretty upset at that point. It all seemed to happen kind of quickly to me. They were really just focused on getting the baby out as quickly as they could. I remember she wasn't making any noise, and it was terrifying. They rolled me past their tiny nursery for about maybe 30 seconds so I could look at her, but they were still working on her, so no, I didn't get to hold her.
They moved Kathy up to the recovery floor, which is one floor up.
Well, I guess the nurses noticed first that something was wrong with me. They noticed that there was just a lot more bleeding than normal.
You could watch the blood pressure just, rapidly keep dropping to numbers that weren't healthy.
The doctor said he needed to go back in and do more surgery and try and figure out where the bleeding was coming from. And that is really the last thing that I'm aware of that happened there.
Of all the scenarios that could go on, your daughter goes an hour and a half to Alexandria, Louisiana. You got another 2 kids on Fort Polk. Your wife is going in the operating room, and hopefully it turns out well, and hope and pray and wait.
We arrive at Fort Polk, we unload our equipment we need, we go into the hospital. The stretcher was covered in blood because she was bleeding profusely.
She was cold, lifeless, pale.
I felt bad for her husband. I felt bad for her child she had just had, because I wasn't sure that she was going to go back to her husband, or that she was ever going to see that child she had just had.
Watching somebody fly away in a helicopter, it's not something you always want to see. I've seen it plenty of times in Iraq, but not something you expect for, going in and having a baby.
Flight time for us to fly from Fort Polk back to LSU was 39 minutes. The drive time would have been approximately 2 hours or more, depending on traffic and those things.
They'll give us a heads up. Usually they'll give us a shout out 15 minutes prior before their arrival, so we can have our drips ready, pumps ready, everything on standby that they have running in the helicopter with her.
Sometimes if we request additional help, they will send up 1 or 2 nurses, and we go all the way to the bedside with the patient, and then that's when we turn our care over to the nurses and the physicians at LSU.
I like to describe it as controlled chaos. And that is that if you were to walk in and you were to see 12 people running in different directions with a large group around the bedside, everybody doing something different, you would think, oh my God, there is no way they know what they're doing. But in actuality, the MICU team at LSU Health has worked together for such a long period of time that everybody knows what their role is.
She's bleeding out. She's sick. She has no blood pressure. She was, I guess you could say, on death's door.
Unless we figured out where the bleeding was coming from, how to correct that, Kathy's life was definitely in danger. We called down to radiology and asked them for a stat, CT. Luckily for us, one of the things we can actually see the images as they come across while the patient is in the CT scanner. And it was very evident to us during the scan that we actually could see the bleeding site.
Once we get that call, we call anesthesia, and everybody gets to work, and we head to the operating room and start setting up.
Dr. Black came in on her night off, which shows what kind of a team we have at LSU Health.
We sort of made a game plan. I have Dr. LaCour as a partner, and we work closely together. And in this situation, we felt like it was in the best interest of the patient for both of us to be there. We had a great resident on that night, Dr. Conrad, and Dr. Briette calling us in there and moving things along. It all came together very nicely.
We rolled her down to the OR, and we left her there with the OR team, and we came back, waiting on her whenever the doctors were finished with her.
Found our way up there. Found Dr. Greer.
We're all focused on Kathy, but we have to remember that there's a man outside that has a baby in a hospital in another city. He has a wife up here that is dying in front of our eyes, and he has two other little girls that are at a home down at Fort Polk at an officer's home that he barely knows since they just moved down there. And he hasn't, that poor man is just, I couldn't fathom what he was going through at that period of time.
We ended up losing Kathy. How do we explain that to two little girls who were so excited about having a new sister? How do you pull back? Tell them that everything was all right. 7 hours later, they don't have a mom.
What he needed was somebody to tell him the truth. This is what's going on. This is what we're treating. This is what we think. And this is how we're going to handle it. And this is what her chances are.
Dr. Greer was able to explain everything confidently and allow me to trust they had all the right people in the right room.
It was a dangerous situation, and I knew that as a team, when we got in there, we had to move it real quick. There wasn't much room for error, and everything had to come together perfectly.
When she got there, I remember her being extremely pale as we moved her over to the OR table.
Just in the abdomen, when we opened the abdomen, there was 2.5 liters of blood. That's a lot of blood.
Dr. Burdick and I, we stayed. We helped our anesthesiology colleague, with blood transfusions or assist with whatever that they needed.
We were able to put pressure in the area, and they were able to stabilize her a little better, and then we were able to repair the injury, and I knew that I felt really good about it. I felt like she's gonna do okay.
We got that phone call. She's gonna be coming back, so we'll all gather back in the room and just kind of wait her arrival.
She came back from the OR stable with the blood pressure, and it was a huge relief for all of us.
They were getting Kathy hooked up and settled in, on the floor, and then we were allowed to walk in.
And I remember him holding Kathy's hand whenever there was a point that we could let him back to see her.
Her face had color to it. There was something different than what you saw when she left.
After the case, I actually did go speak to Mr. Heitz and did tell him, I said, she's resting peacefully. Go check on that baby girl. Go back home. Go check on those two other baby girls. Get some rest. Come back sometime tomorrow, and we'll go from there. I've got your number. If anything happens, we'll give you a call.
I remember opening my eyes and hearing doctors and nurses saying she's waking up and trying to talk to me. And then the next thing I remember after that is waking up with the tube in my throat.
They had told me that Kathy had started to wake up, and started pulling at her intubating tubes, and that she was pretty feisty and pretty upset, which I knew that she was going to be all right.
The most awesome part was the next night at work. We come in, and I looked to my right, which was the first room on the right, and is that the same girl? Oh my goodness. She just completely different. Just amazing.
It was a great feeling to see her alive in pink.
When Mr. Heitz actually showed back up, I was like, there's been a change in plans. And of course, he got this terrified look on his face and said, no, not that kind of change in plans. And I said, just come with me. And we walked down to her room, and I just kind of did this, and he walked in and looked at her, and she was sitting up in bed and smiled at him, and he just looked at me, and I went, patted him on the back, turned around, walked out of the room, and just let the two of them have their moment.
I could just see some tears, and he was looking down. It was sadness, and it was happiness, and it was, I think, everything that he had felt for the whole day before.
In Kathy's situation, she was at an outside facility who had done everything that was in their power and their capability of doing. And without her ability to come to LSU Health, a university hospital, higher level of care, Kathy would have died.
There's nothing that can describe how grateful I am for them and for what they do.
There's just a strong workforce here of doctors, nurses, assistants, and they all seem to come together in these kinds of situations and pull it together for the best of the patient.
Just knowing that I was able to play a part in taking care of this patient and allowing her to go and to be with her family is the best feeling in the world.
I'm glad I was chosen to be her nurse because that's what I like to do. I want to take care of these patients. I want them to live. I want them to be happy. This is why I'm a nurse.
We're a team, and we do this for one reason and one reason only, so that at the end of the day, people get to go back home to their loved ones and raise their kids.
It's always wonderful when you get a letter from a patient, but this letter was super special. Whenever I'm having a bad day, I look at that letter.
I've been writing this letter in my mind for months, but the words never seem to be able to fully express how thankful I am for all of you. But please know that I search for them daily, as I enjoy every precious moment with my family. I will always be thankful for everyone who helped me when I came to LSU. You gave me a second chance to be a mother. When I hold my sweet 6-month-old baby, when she smiles and giggles, I am thankful for you. And when I sit down with my husband after a day full of the wonderful craziness of raising 3 little girls, I am thankful for you. You are my personal heroes, and I look forward to the day when I can tell my girls about the amazing group of people who saved my life.